Hey, Dr. Pejic.
Hello.
Do you have any tips for people who are experiencing panic attacks?
Yes, I have 4 tips for folks who have panic attacks. Number 1 is to look at whatever substances they might be using. A lot of times panic attacks are caused from excessive amounts of caffeine or someone who drank a lot of alcohol the night before and they wake up and their body is withdrawing from alcohol. That can trigger a panic attack. And they may not link the use of alcohol the night before with the actual panic attack the following day. So that's one of the things there too. Also, some folks are using other substances like maybe cocaine or marijuana, or they're actually drinking alcohol and they feel more anxious rather than relaxed, and that can trigger panic. And then lastly is medication. Sometimes folks are taking a new medication. Sometimes, let's say like Wellbutrin, for example, it may be too stimulating and cause panic, and they may or may not know if it's linked to the medication itself. And then there's times when folks take SSRIs like Prozac, for example, and if it's dosed too high by the doctor, that can cause panic attack and really freak folks out because they say, well, why am I taking this thing? It's supposed to calm me down when it's causing panic. And so the answer for that is that the longer they take the medication, if they successfully can start something like Prozac, the panic dissipates over 2 or 3 weeks. But sometimes that backfires and it can cause a panic attack. So that's my first tip, is just about substances. Second tip is about diagnosis. People have panic attacks, sometimes confuse them with other diagnoses. So it's important to meet with someone to be properly diagnosed. And the 2 or 3 diagnoses that revolve around panic attacks are panic disorder. That's when folks have an overwhelming tidal wave of fear happening out of the blue, and that they have a panic attack. And then they have rolling panic attacks, like daily panic attacks, and they start to worry about when their next panic attack will occur. That's called panic disorder. And it's important to know that ahead of time so that they can get properly diagnosed and properly treated for it. Beyond that, some folks have agoraphobia, where they get a panic attack, where they are on a bridge, driving over a bridge, driving through a tunnel, driving on the highway, at a Target, at a Walmart, at the Superdome, at a mall, sometimes on a streetcar. And the reason for that is all those things tethered together. There's a fear of not being able to escape. If you've ever been to like a Walmart, you have this big box store, you don't really quite know where the entrance and exit is immediately. Like you have to walk a far away to get to there. And once you know that that's happening, it kind of clarifies to folks what their diagnosis is, and they can understand it better. So it's kind of the psychoeducation one that's needed to deal with panic. So other diagnoses that can lead to panic attacks is something like generalized anxiety disorder, where somebody is worrying a lot and they're worrying so much that it triggers panic, but the panic attack is in the context of worrying excessively. When they know what their diagnosis is, then they can talk to a therapist or a doctor about it and get properly treated. So that's kind of a second tip. Many of my patients have had panic attacks for years at different frequency, and they just never linked it to any of the diagnoses, and they don't have clarity about it. So it delays them getting help. So that's why I list it as a tip. The third tip is breathing. There's a way of doing some deep breathing, but when I have patients tell me that they've learned some deep breathing on the internet or something, they're actually breathing too quickly. The proper way that I teach my patients, and this is, if anyone's listening out there, they should ask their own doctor about this, but I like to have patients take a deep breath, retain the breath as if they're holding their breath for a time. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, and so on. And then to purse their lips and blow out slowly, kind of like you're letting air out of a balloon, but you're holding it back a little bit. So it's like, have them hold their breath, and then they purse their lips, and they let a small trickle come out. And what that does chemically is it helps you retain carbon dioxide, and carbon dioxide at your brainstem can be calming. And that's one of the mechanisms by which we help control panic. So if someone's having a panic attack, they can do that type of thing. If they're breathing too quickly, they can blow off too much carbon dioxide, thus hastening the panic attack, which is terrible. So that's the third tip, is breathing correctly. And then the fourth thing is life transitions, understanding one's life transition. I have folks who are going to get married and they get panic attacks. They buy a new home or get a job promotion. They're going to have a child. So in our 20s, like when somebody's in their 20s, there's lots of these different transitions as well as their 30s. And those transitions can lead to having panic attacks or panic disorder, but they're like happy things too. So folks it can be confusing because they don't know why they're having it. Like why would you have a panic attack? Because you're moving into a new house. They can afford the mortgage. They know they can afford a mortgage, but it's that deep transitioning of that personal growth that leads to kind of like a molting of the old skin, if you will. And that can bring that on. So those are the 4 tips. Look at your substances. Number 2, get properly diagnosed. Talk to a psychiatrist, a family doctor, a therapist. Number 3 would be to learn proper breathing technique for it. And number 4 would be to ask yourself, like, what life transition am I in right now? And if you are in one, talking to a therapist and working through that can often help with those symptoms.
All right. And then one bonus question for someone who hasn't experienced a panic attack before in life, but maybe they're going through these transitions. What would you say a panic attack feels like? Someone who thinks that they're having a heart attack versus they had a panic attack. What can you describe very briefly?
Yeah, it's an overwhelming sense of doom or foreboding. Also described as a tidal wave of fear. It's like the worst anxiety they've ever had in their life. Sometimes it feels like they're dying. So I wouldn't wish a panic attack on my worst enemy. I've had one after doing yoga and drinking too much water. I think I lowered my sodium levels in my body. I was like pounding water in hot yoga, and I had a panic attack, and it was terrible. So medical things can cause panic. So I personally have been there. So it's a tidal wave of fear, and sometimes panic can be something medical, like a pulmonary embolism can cause anxiety. There can be an actual heart attack. So many of my patients, the way they're referred to me is they visit an ER because they had their first panic attack, and they get medically cleared. They say, you're totally fine medically. You haven't had a heart attack. Your lungs are clear. You don't have a pulmonary embolism, so on and so forth. You don't have a heart arrhythmia. And then they say, go see a psychiatrist, and they'll refer them into us. So that is a really good point that you're bringing up, that it can be medical, and that it needs to be one needs to be medically cleared first to ensure that it's not something that can be fixed another route. But if they're having panic attacks that are not from a medical cause per se, except for like the alcohol or substances, then usually they would come to us and we would take care of that.
Well, thank you. These are wonderful tips.
Sure. Happy to help. See you next time.
See you next time.
All right.